on 30th of October 2013. Remember, terms and conditions apply. Happy Independence Celebration Nigeria, powered by MJF Travels and Tour and PRTV, Africa's first radio TV station.
Welcome back to the biggest and brightest breakfast show across the African continent. It's Good Morning Africa, the weekend of Friday morning. It is. We're excited to be here, aren't we, Taras?
We are indeed excited because we're going to talk about health matters.
Oh, I love that.
Let's check out what integrated primary healthcare is all about as our crew takes us to the Inter Academy Medical Panel Conference 2013. Let's find out more.
Integrating mental health with non-communicable diseases into primary health care. Non-communicable chronic diseases, NCD, and mental disorders each constitute a large portion of the worldwide healthcare burden, and they often occur together. Collaboration is needed between policymakers, practitioners, consumers, public health researchers, development agencies, and funding organizations to develop globally coordinated strategies. However, without country-level recognition and uptake, research and policy guidelines will never translate into action. Economic and health policymakers, including government officials who control health budgets, are often not aware of the links between NCD, mental health, development, and economic growth. These leaders need to be a part of the global discourse and the development of local solutions. We must invest in designing healthcare systems that recognize and address the commodity between mental disorders and chronic physical illnesses before we are crippled by the rise in the non-communicable diseases and mental health conditions. Of the 57 million global deaths in 2008, 36 million or 63% were due to NCDs, principally cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases. As the impact of NCDs increases and as the populations age, annual NCD deaths are projected to continue to rise worldwide, and the greatest increase is expected to be seen in low and middle income regions. Non-communicable diseases are the leading global cause of death, causing more deaths than all other causes combined, and the strike hardest are the world's low and middle income populations. These diseases have reached epidemic proportions, yet they could be significantly reduced, with millions of lives saved and untold suffering through reduction of their risk factors, early detection, and timely treatment. While popular belief presumes that NCDs afflict most high-income populations, the evidence tells a very different story. Nearly 80% of NCD deaths occur in low and middle income countries, and NCDs are the most frequent causes of death in most countries, except in Africa. Even in African nations, NCDs are rising rapidly and are projected to exceed communicable, maternal, perinatal, and nutritional diseases as the most common cause of death by the year 2030. Primary healthcare is not well programmed to deliver preventive or treatment services for NCDs, and Africa has some way to go provide integrated primary healthcare. Access to specialized procedures is not optimal. Let's hear from the expert in regards to developing models for integrating NCDs management into primary health program.
I'm Professor Inge Petersen from the University of KwaZulu-Natal. I'm also the principal investigator for the program for improving mental health care in South Africa.
Hello, so I'm Lara Fairall from the Knowledge Translation Unit at the University of Cape Town, Lung Institute, and I'm a health systems researcher, and my main interest is about bridging the gap between what we know for healthcare and what we provide in primary care services.
Okay, so what we're looking at in South Africa is how to integrate the care of mental disorders into the non-communicable disease service delivery platform. And in South Africa in particular, what the Department of Health has done is that they've actually, in terms of service delivery, integrated people with non-communicable diseases and those now with chronic communicable diseases. and they're piloting this in various sites.
So I do two main areas of work. The first is to develop packages for healthcare workers who work in primary care to help them deliver evidence-based best practice care to patients in resource-constrained settings. And the second is to research how these work and whether they actually impact on the quality of care that is delivered to patients and on the outcomes for those people.
So people with, for example, people with HIV who are on ART treatment will be treated at the same point as people with, for example, hypertension, diabetes, etc., because many of these diseases are comorbid. So we're looking at how to integrate mental health and particularly the treatment of depression and alcohol misuse into that service delivery platform. In South Africa, about 1 in 6 people have a common mental disorder, but the treatment gap is 1 in 4, so only people actually get treatment. So there's a large gap that we need to address. And how we're doing it is that we looking at two things, bringing two innovations together. The one being strengthening these guidelines, the Primary Care 101 guidelines, which are integrated management guidelines for nurses to identify and treat chronic diseases. So we're strengthening the depression aspects of this as well as the alcohol misuse aspects of this.
So our program has actually been adapted for use in Botswana and has been piloted there, and in the context of improving non-communicable disease care. And the predecessor for this program, which focused on communicable diseases, has been quite widely implemented. It's been adapted elsewhere in Malawi and in the Gambia and also in Brazil and Mexico. And it's been very widely implemented in South Africa, reaching over 19,000 health workers in 2,000 of the country's clinics.
First of all, in terms of mental health, what we mean by mental health is problems like depression, anxiety, alcohol misuse. Those are more common mental disorders. And then our more severe mental disorders are psychotic disorders, schizophrenia, bipolar disorders.
So primary health care is about bringing health services to the people and making it more accessible for them to access effective care for common priority conditions. And much of it has been focused around HIV in Africa over the last 10 years, as we've scaled up antiretroviral treatment programs. We started off providing antiretrovirals in outpatient facilities at hospitals, and then we realized this was too burdensome for patients. Patients couldn't travel to and from hospitals which were remote. They needed to be able to access care like this, which is life-saving, close to home. And this is really the role of primary health care, is to bring health services to the people's communities, to where they live.
But in relation to integrating mental health into the non-communicable disease agenda, why it's important is that we found that depression is on the rise globally. So depression will be the second leading burden of disease in 2020. And depression in particular is a problem with people with other non-communicable diseases. So about 1 in 5 people have depression who have a non-communicable disease as well.
And so the antiretroviral treatment program has really reshaped the way we look at care in Africa. And it has brought services to people. And this has also involved interventions like task shifting, where the onus for assessing people, initiating treatment and monitoring their treatment has shifted from doctors who are based in hospitals to non-physician clinicians who are based in clinics. In South Africa, those clinicians are nurses, and elsewhere in Africa we have clinical officers or medical assistants who provide that level of care. And so antiretroviral treatment programs have really revolutionized the way that primary care is seen in Africa. And that's great news for NCDs, because we're now facing this increasing burden of NCDs alongside communicable diseases. So it's now time to shift NCD care out of hospital-based services and into primary care services so that people can access treatment for NCD risk factors like high blood pressure close to home.
Studies show that depression actually can compromise both prevention efforts to control the spread of non-communicable diseases, as well as treatment efforts, because depression often interferes with many of the risk factors, the malleable risk factors for non-communicable diseases, and it also can interfere with compliance. So with some studies showing up to about that people with depression and a comorbid non-communicable disease can be 3 times less likely to take their medication.
Well, I think my first piece of advice is not for the patients, but for the planners of the healthcare systems, okay, which is that the time to decentralize NCD care out of hospitals and into primary care is now. And we need to really leverage the investments we've made in communicable diseases and follow on with that, and do it in a way that's integrated, so that we don't have cases of patients having to come to separate clinics and repeat visits. People can really come to a fully realized primary care model with a one-stop shop where they can receive all their treatment and care. For the patients themselves, I suppose it's about, and for people themselves, it's about empowering themselves with the knowledge that they need to manage their own health. Chronic diseases are now part of our lives. You know, more and more of us will grow older with one or usually more than one chronic disease. And so it's really about equipping ourselves with the knowledge we need to be able to manage that.
So basically integrating mental health, and particularly for our common mental disorders, anxiety, depression and alcohol misuse, is the smart thing to do, because it can actually help protect the investment in NCD care, as well as improve health outcomes, and additionally strengthen systems to be able to provide more integrated chronic care and more patient-centered care.
There you have it, folks. Inter-Academy Medical Panel Conference 2013, talking about health matters, integrated primary health care in Africa.
Well, it's a Friday morning. It's time for some entertainment. By the way, thank you so much for all that health matter. It's always good to learn more about our health.
Definitely.
Matters. It's just that I'm so excited to announce this next group who's going to perform here for us. They go by the name of Bracket. I wonder if they're going to sing our favorite song.
Definitely. Let's check this out, you know?
Let's check it out.
Yeah.